Well, I feel like it's 5 minutes after, and I feel like we should get started. So I really, first of all, I wanted to say welcome to everybody. This is a call of the Labor Network for Sustainability. We've been doing a regular virtual convergence series where we talk about key topics in the labor climate movement that kind of transformed out of the September climate strikes labor table, and it transformed back into the Earth Day climate strikes labor table. But we're kind of putting that on pause or transforming that tonight to have a critical conversation about how the landscape is changing for the labor climate movement, but more broadly for workers and for unions in this moment of both economic and health crisis. So first of all, I just want to say thank you all for taking the time for being here. I know this moment is difficult and emotional and different difficulties for different people. And so I know being present in this space and any spaces takes a lot of putting ourselves there. So I want to thank you all for being here and joining us in this conversation. Because the truth is, right now, we're in a moment where everything's shifting, right? Like the paradigm that we're in is shifting pretty dramatically. And it's not just a change in our material circumstances, but it's a change in what's possible. It's a change in maybe values, priorities, how we understand the world. And I think naming that, at least for me, helps me think about, what do we do in this new reality? We can step back and examine that change and help us think about, gives a little structure for us to think about what's valuable to do right now in this moment. So today, the first part of our agenda is really going to be focusing on workers at the front lines of this crisis. Right, we've got some folks on the line who've agreed to present on how workers in their union, how their own workplaces are being impacted, and how organized voices are responding to that. And I think as we're thinking about this broadly, it is important to think about there are two crises we're facing right now. There is a crisis of public health and the coronavirus, and there's the economic crisis, and they are very connected, but there are different impacts that are different for different workers, for different unions, and I think we have to give space to that. I think most of our reports tonight are kind of more from workers who are really in the front lines of the healthcare crisis, but there's obviously some overlap in conversation there, so it's all important as part of this. Our goals for tonight is really to lift up areas where we need to focus on as a movement right now, learn from each other, start generating ideas of how labor can engage in climate work in this modified time, and building space for discussing kind of the longer term impacts of what are going on. So that's kind of our goals, but this is really this, we might not come out of here with these are the 10 action steps we're doing, right? We're trying to create space to have this conversation with each other. So with that, we're gonna start off tonight with hearing from nurses and healthcare workers, and then teachers that have played a critical role in the fight to make sure we have the social distancing necessary to that our healthcare workers can respond to this crisis. And then we've got workers from the food chain who all of a sudden are critical infrastructure workers. We knew that all along, but all of a sudden that's being recognized. So we want to lift up the organizing that's happening in that space. So to start us off, Elizabeth Laszlo is going to report on what's happening in hospitals. She's a registered nurse and a really key activist with National Nurses United, has been taking care of patients and at the same time advocating for nurses to have the equipment they need, for cities to do the right thing and shut down. And she's going to share with us a little bit about that. So Elizabeth, can I turn it over to you?
Sure, thanks, Lauren. So I appreciate everyone being on the call. And all the things that Lauren said about this being a really critical time. And for nurses and healthcare workers, we are feeling this in a very acute way. in our workplaces. I'm sure people have read in the news. The whole idea of social distancing really is premised on the idea of attempting to lower the numbers of cases of people who potentially could develop coronavirus. And people have been implementing that, although we have a long way to go. In the United States, I'll be perfectly honest with you, given our for-profit healthcare system is not in the best situation to actually handle the numbers of patients that we are projected to see. Obviously, places like Seattle, state of Washington, San Francisco and California, and New York is now the epicenter, are feeling this most acutely. And so, you know, what we are trying to really push for as nurses is to be in the best possible position to take care of patients, and looking at places like what happened in Wuhan, what is also still continuing to go on in Italy, really is of concern to us. So in the United States right now, people probably have read, we hope the word is getting out, are really short on what we call personal protective equipment, which are the basic, you probably saw those in pictures from Wuhan and from Italy, where people are in hazmat suits, healthcare workers with masks and plastic guard shields over their faces. Those things actually help us to be able to take care of patients and try not to actually become infected with coronavirus ourselves or pass it on to other patients that we might have. We're in a crisis situation right now with personal protective equipment. A lot of the Center for Disease Control guidelines have been relaxed. And so instead of us having the proper masks, they're called N95 masks, and in some instances gowns and shields, we are being told that safety masks are adequate because this coronavirus is only droplet. Well, you know, there's a lot of information. The World Health Organization just came out saying that, you know, it can actually exist in the air and therefore it is airborne in addition. I know that might sound like inside baseball for healthcare workers, but really it's about us being in the best possible protected situation. And unfortunately, in places like New York, I have, you know, friends who are nurses there. You know, the standard of CDC is being, you know, kept in place with only surgical masks. And we have a critical shortage of what we call N95 masks. So we're really pushing on trying to push the government. Now, I know Trump came out today and made an announcement that he's implementing, I can't remember the name of the act, but it hasn't been used since the Korean War to up production of medical equipment and personal protective equipment. So we really need to continue and is going to be apparently releasing, hopefully, production of millions, but that won't help us. It'll help us in the short term, but we really need to push for the long term. So we're really looking to help get people to really push on the federal government and also the state governments. Trump has come out to say to governors that we also need ventilators and we need more ICU beds, that governors should find their own ventilators. I mean, the situation is at a level of that kind of crisis. And so, you know, our workplaces, you know, really look at the potential for exposure. Over the weekend, we had a number in, I work in a public sector hospital in Chicago. It's the busiest hospital in the state of Illinois. The population is obviously people who have not had good access to healthcare, people of color, some of the most disaffected, some of the most at risk to actually contract coronavirus. And we had a good number of possible exposures, particularly in the emergency room, where people were not provided N95 masks while they were trying to intubate patients. And so, you know, intubating basically means putting a tube down your throat so you can breathe. It's kind of hard to do that and slow down and get a mask at the same time. And the masks are being basically held by coordinators and management in the hospital. So we are pressing very hard on them to give us access to those for both doctors and for nurses and any healthcare providers, as well as, you know, training about what needs to be done. A lot of this is amped up, but we will need to continue to press on our hospitals individually, but also, like I said, the federal government to really provide that equipment to us. It's essential so that we don't get sick. So there's enough of us to actually take care of the people coming in with coronavirus, and pushing on us getting ventilators, ICU beds. And then my union, National Nurses United, has been really leading this in the country. It's the largest registered nurses union in the country. And so we have petitions out to Congress. We've done press conferences. We're continuing to put out demands, which include optimal PPE, which is what I've described earlier, for healthcare providers, as well as we'll have more things coming out in the coming days that we would, really like people to take on, which, we're going to be putting out social media, we're going to be putting out a lot more things. So I'll wrap up this. That's sort of the situation. Not sort of, it is the situation in the hospitals around the country. And we expect that things will actually get worse over the coming weeks and months. So as much pressure as we can actually, getting the word out about this, and as much pressure with the resources that people have through LNS and everyone on who's in labor and environmental groups, would be extraordinarily appreciated by everyone in healthcare. So I'll stop with that.
Thank you, Elizabeth, for sharing that. And I dropped in the chat box, there's a petition out. There probably will be more petitions. Still figuring out the best way to show support, but at least this is a way to start. And I think, through this network, we have to think about other ways to lift up and fight to support NNU in their efforts here. And it's not just NNU, right? Healthcare workers aren't just nurses. There are a lot of healthcare workers in hospitals who do a lot of different jobs. And so I'm going to actually turn it over to Estela Vasquez, who's Executive Vice President of 1199 SCIU, to talk more broadly about healthcare workers and about 1199's work as well. So Estela, I will turn it over to you.
Okay, Lauren, and just one correction. I am no longer, I serve in a different capacity in the union. I don't have presently the title of Executive VP, but that is correct. That is correct. Okay.
Former Executive Vice President, excuse me.
I'm covering, I'm giving the report, and our executive, Secretary Treasurer, Maria Castañeda, cannot join the call because we're having a teleconference with all our rank and file leadership in 5 states. So let me just add to what my sister from the National Nurses Union has raised, the whole concern about PPEs in every hospital, in every nursing home, for every home care worker that we represent is at a critical situation. Between yesterday, which was Tuesday, and today, the number of confirmed corona cases has increased by 1,000 in New York. So now we have 2,383 people diagnosed across the state. And today, the governor called in for all businesses, and I will list the exceptions later, to reduce the workforce, people that report to work, by 50%. The exception are essential services such as food delivery, pharmacy, healthcare, and shipping and supplies. In terms of our membership, we represent workers, we represent from physician's assistant, lab techs, x-ray techs, nurses, housekeeper, home care workers, all across every job you can think of in a hospital or a nursing home. And the situation in terms of personal protective equipment is really critical. There is not enough supplies or training for the N95 mask. We are facing, this is not just, like Lauren, you said before, a public health. This is an astronomical economic crisis, which we don't know how much longer is going to last. In terms of what we've been doing in 1199, we are working to show information, support, communication to our membership. We have yesterday held a staff conference, teleconference across 5 states. We have modified work hours, staggered work hours. We have staff working remotely from work, from the job. Today, we are holding a press conference, teleconference, I keep saying press conference, teleconference across 5 states with our rank and file leadership. And tomorrow, we're going to reach as much as possible, as many members through the telephone. What we've been doing in those calls is having representatives from the New York City Department of Health, representatives from our benefit fund, our medical director, and then having give a presentation, and then have whether it is staff, rank and file leadership, or members asking direct questions. Some of the areas that we are, because the schools in New York City have been closed, our child care fund is working on looking to alternatives of how we can support members in this crisis. We are using all forms of communication, teleconferences, email blasts, all platforms of social media to be in contact, in reaching out to our members, and using all our political influence and to support the increase in the resources to ensure that our members that are in isolation or who are not required or are working, not required to go to work, are getting their salary. We are pushing for the increasing of the supplies, and we are especially concerned about what is called safety net institutions. These are hospitals that serve in the areas of most need, where undocumented workers usually end up in an emergency room seeking for assistance. We will continue to communicate, to push, and like our sister from the National Nurses Union say, to continue putting pressure on the federal government and also on state and local authorities to ensure that healthcare workers in all levels, from doctors to the housekeeper that preps the room when a patient is in there, or to the people that prepare the food and serve the food to the patient, that everybody is protected and supported, and working also with our employers to ensure that the necessary supplies and the PPEs, the personal protective equipment, is available.
Thank you very much.
Yeah, if there are any questions, we can move to that later.
Kind of hold questions until we get through all the speakers, just so we have time. So if you're okay with that, we're going to go ahead and do the presentations and then move on to questions at the end. So I thank you both for that really comprehensive picture of what's happening in our healthcare system and how workers on the front lines of this crisis are being affected. I want to turn the conversation to focus on teachers for a second, because teachers are critical workers in a lot of ways, but teachers have played a critical role in pushing to shut down school systems in the last week. And I want to turn it over to Bill Schiebler from the AFT National Union, whose focus is on human rights and community relations in the union, with the American Federation of Teachers, to talk about what members of that union have been doing across the country. So Bill, I'll turn it over to you.
Thanks so much, Lauren. Yeah, so I think a couple of things just to sort of report out, and just thanks for allowing me to be on the call, and thanks to everyone for, to all the different unions, to everything everyone's doing out there. It's such a critical time, and I think, most importantly, we are trying to as we often do, create a community for each other in and through our union. And I think we're going to have to do that more and more and more with each other and for our members. So I think this call is really important for that, and many, many more of them. We have been trying to, number one, get educators and school support staff, school nurses, guidance counselors, everyone, the resources that they need to support the students and the families that they work with every single day. And so as school closings were sort of looking inevitable, to make sure that, we were actually moving towards, limiting sort of social interaction, we wanted to make sure that educators were getting the resources they needed to begin to think about how do students still get educated online or virtually when they haven't been? How do students who depend on breakfast or lunch in schools get meals when they need it? How do, sort of resources that parents or families look to that are housed at schools and cities get them elsewhere? And so we have been trying to put up a number of resources. There's information for parents, for educators, school staff, healthcare workers, et cetera, on a website that we put together. It's at aft.org/coronavirus that you could get more information. And there's a lot of good content, I think, there that's been helpful. A couple of things that I just want to lift up a little bit. We've been trying to mitigate the impact of this crisis as much as possible. Helping move people towards closing schools and not spreading the virus was one effort. Taking extra precaution for English language learner students with special education needs and stuff like that is something we're still working on and trying to provide that support for families. And we'll continue to do that. We're working with a number of everyone from, food banks to philanthropic foundations to local governments to try to make sure that the things people depended on in schools are still available to them at remote sort of centers, that they can still access that stuff. So that's been one big area. The other big area that we've been focusing on is while we're trying to, support and get folks what they need, we also are trying to bring people together in coalitions of union, community, labor coalitions to make, common good demands or proposals for what students, families, and communities need in this moment. And that's taken place at a city level, at a state level, and federally. And so it's included, basic stuff from, how are we going to make sure that, there's funding for people to still, like I said, get meals or food to? How do we make sure that, there's going to be paid sick leave or family medical leave, et cetera, et cetera. And so we've really found some success in pulling together these community labor coalitions in cities and states, call for sort of bold investments right now that protect and get our communities the resources that they need. And so far, there's been several, at the state level, we've seen things from state legislatures, passing funding proposals or bills to sending directives to health insurers, to creating task force that actually have teeth to implement things. And on the federal level, we've been sort of very, very involved to make sure that each one of these stimulus packages, as much as possible, is benefiting workers and families and not just corporations the way the administration would want. And one thing I'll just say lastly on that is we put together, it's like a 4-page document. We're about to enter, Congress just pushed through another bill today, but the next one, everything from what we can tell is we're going to be pushing or advocating that it's at least $1.5 trillion in terms of an investment or a stimulus. And we've put together sort of a 4-page document that has a list of asks that I think I would encourage folks to take a look at. And if your union thinks it makes sense to support, to include those asks in your conversations or your advocacy with Congress. Things from making sure that there's a sizable amount of money going to household consumption, that there's fiscal aids going to state governments, because under our Constitution, the states can't take out loans the way the federal government can, so we need it to come from the federal government. There's a whole list of things on there. So, I sent it to Lauren so it can get circulated around, but I really encourage people as we're thinking about advocating collectively for this next bigger federal financial stimulus. If you think it's a resource, to please use it. And I'll go ahead and stop there.
Thank you so much, Bill, for all the work you're doing and that great report on it. I will make sure we get the document shared out, just working on appropriate formatting, share it out with you guys. So working on that. So now Bill spoke to the critical work of keeping kids fed, but there are a lot of workers out there who are doing the critical work of keeping all of us fed. So first, I want to focus on grocery workers, and then we'll move down the food chain to farm workers, or move up the food chain. I don't know which, somebody needs to school me on which way the food chain works. But Steve Williamson is a former retired staff person from UFCW Local 21 in Seattle, and that local has done some really great work on pushing in this crisis for the rights of grocery workers. So Steve, I will turn it over to you.
Thank you. What a way to learn how interconnected we all are, as the labor movement obviously has known for a long time. Appreciate the work everyone's doing. Just want to highlight the website of United Food and Commercial Workers Local 21. It's ufcw21.org. On there they have a number of things, but most important is a set of agreements in the healthcare industry. Just to touch on that for a second, they represent 20-some thousand workers, and I'm just a consultant for the union, retiree. I'm not working for them. They're busy negotiating other deals right now with employers. But it's an agreement with the Washington State Nurses Association, SEIU 1199 Northwest, and UFCW 21. And what I want to say about that is, because that industry is highly organized, as it is in most parts of the country, but it's very highly organized here, it gives them a lot of power. They've had a couple of strikes recently, near strikes, and so the membership statewide is highly mobilized, paying close attention. And you can imagine, obviously there's folks organizing restaurant workers, ROC, Unite Here, and others. But let's say the restaurant industry was highly organized, the kind of power they would have to bargain for restaurant workers right now. We're estimating, a report yesterday said in Seattle that by June, we will have lost 750,000 jobs in the Seattle metro area, just for some context. So the contours of that healthcare agreement I spoke to is on the website, but they have 4 principles. And I think what's important there is the details matter in terms of what people are getting, but also beginning with principles. So the first one is the parties share a mutual interest in assuring the health and safety of patients, clients, families, staff, and community. And this is with a hospital system. Second one is nurses and other nurses to patients in need. Third one is decisions of all parties should be guided by the Center for Disease Control and other public agencies. And then people can look at the rest of it. I'll jump back to grocery, as you asked me, and just suggest there's a couple of things. First of all, again, the industry is highly organized in grocery in a way that I think is in some parts of the country, but not a lot of parts of the country. And it gives grocery workers in Seattle or in Washington State, again, about 20,000 of them with 3 different locals, including the Teamsters local and 2 UFCW locals. And again, both of these sets of agreements were with multiple unions coming together to bargain together, which I think, again, is an important feature. So, and of course, one of the main features of the grocery bargain, which almost also ended in a strike just in this past year, is protecting the healthcare benefits of those workers. They have excellent healthcare. Of course, now is the time that they're cashing in on that. So they're getting, for instance, up to 2 weeks of pay for any worker diagnosed with COVID-19 or anyone who's required to self-quarantine before accessing any kind of contractual benefits. So it goes on from there. The second point is agreed to work jointly with state and federal government to treat grocery store workers as first responders and set up a child care fund for grocery store workers. So again, establish of what the as essential cogs in our community. So I'll stop there. I really didn't have anything to do with bargaining any of this stuff. None of those folks could get on the call, so they asked me to do it. But they are a great resource because we were a little on the front edge here in Seattle. I think they got a head start on it, and they've been very aggressive in doing that work. Thanks again for allowing us to participate.
Thank you, Steve, for bringing that report and speaking on behalf of the great work that UFCW Local 21 is doing there. While we're on food workers, we're going to focus on farm workers for a minute. Edgar Franks, who's the political director with Familias Unidas por la Justicia, is on the call with us, and I'll turn it over to you, Edgar.
Thank you. Hope everybody's doing good after one another. So I'm Edgar with Familias Unidas por la Justicia. We're based here in Northwest Washington. Our office is in Burlington. We represent around 500 workers that are under contract right now at a company called Sakuma, and we have over 1,000 other members that are members but not under a contract, but we represent them anyways. So I think the situation here has really escalated, Washington being one of the ground zeros, if you will, for the coronavirus. We've been seeing kind of just the reactions that have been happening from other sectors of work. But a lot of the protections that are offered to other industries and other sectors don't really apply to farm workers. Right now is the peak season for pruning. We live in a big community of berries. I think that's one of our main crops: strawberries, raspberries, blueberries, apples on the east side of Washington. So a lot of those protections that have been offered to people about going home, staying home, the benefits, unemployment benefits don't really extend to farm workers, or there's a big confusion about how even reaching those benefits. We're overwhelmed right now as a small independent union. Just the questions that we're receiving from our membership, whether they should or should not go to work. Schools have been canceled right now till middle of April, so childcare is not really accessible for farm workers. Even we're going to start our contract negotiations, we hope, for this upcoming season. It was supposed to be scheduled for this week, but those are probably going to get moved back. So there's a state of limbo. So when the season starts, about what people's wages are going to be. Within that package of the new contract that we had negotiated, there was a healthcare package and also a childcare package that was negotiated with the company. And a lot of workers were counting on some of those protections, at least get them through the season. But now, because of all the things that are happening, people are kind of up in the air, hands up in the air, because they don't know what's happening. So that's kind of the situation. It's a kind of a desperate time. Another kind of wrinkle that we have to deal with is that the fact that a lot of our community is undocumented or immigrants, and people not willing to put themselves out there, to look for those benefits, those unemployment benefits, or things that are out there to help the general public. There's a big fear also. I think a couple of days ago, it was mentioned that they might start deploying the National Guard or the military, and a lot of people here were kind of, taken aback, because our experience with militarization hasn't been really good. A lot of people see that as a kind of like a signal to, to deport people or to have people at the detention center. So our union is kind of dealing with a lot, and being one of the only unions here that is primarily, it's basically all indigenous Mexicans and Spanish speakers. We're one of the only unions that can offer help, even for workers that aren't covered by other unions, but still are part of our community. people come to us, whether they be retail workers or grocery store workers, when they have concerns. So we're kind of expanding our scope of work beyond just farm workers. One of the other big concerns is that Washington State for the last couple of years has been relying on the H-2A guest worker program. And just yesterday, there was going to be a freeze with all those contracts. And that really puts at jeopardy our food production, our food our food chain, because 30,000 workers, most of them work in the apple industry, will not be hired, or there's going to be a shortage of workers. So that's going to put a big food system, and also within the berries and the dairies, the processing plants that we have here locally, because it's such of a made up of a vulnerable population as it is right now. Just the coronavirus crisis has made life a little bit harder for all of us. But that doesn't stop us from organizing. We try to get creative with the ways we organize, despite the social distancing stuff. I think we're also going to try to take this situation try to turn it into a positive, knowing that a lot of workers aren't unionized right now or aren't getting their needs met by their employers or by the system. There was even talks within some folks about what would it look like if farm workers right now went on strike to get those demands met from the industry. So, we don't want to. We know it's a desperate time, but we also can't stop organizing, especially when the times are hard. Right? Life has always been hard for farm workers, but we have to also think about how does it look like when we go into the offensive and use this time to really look after our communities and get those things that have been denied for us for many years. So yeah, that's kind of where we're at right now. We're trying to build that local muscle and state muscle. We're trying to get a meeting with the governor and some of our representatives to have a response about what to do with agricultural workers and undocumented workers. But yeah, that's kind of where we're at right now with our little union here.
Thank you, Edgar, for that report and all the very crucial work you're doing. And thank you for all the folks who just presented. Just in terms of agenda, I'm going to pause here so we have a little bit of time for questions for the folks who just gave reports. And then we'll switch into updates on Earth Day climate strikes and what the changes are there. And we're not going to do small groups. And so we'll just kind of do the updates as our next steps, maybe some other next steps in there, but just a little modifications for the agenda, but I wanted to give space for those critical reports. So opening up, are there any questions for Elizabeth, Estella, Bill, Steve, or Edgar? Elizabeth Bunn has a question. I'll put you on. Go ahead.
Thanks, Lauren. I don't have a question. I just want to give a shout out to all of the presenters, but more broadly, all of the workers who have, metaphorically run into the burning building. And I think I speak for everyone in saying that to the grocery workers, to the healthcare workers, to the farm workers, you're keeping us alive.
Great. Okay, I'm getting some questions on Stack here. Twyla Jacobson, sorry, I'm mispronouncing your first name. Do you have a question?
Yes, thank you. Twyla is my name, and
Sorry.
I just was seeing some information, and I wanted to ask if we can, in strategizing how we pull this out together, like the suggestion of should the farm workers go on strike, is that we push towards the Green New Deal, which has so many answers for the situation and the post-economic crisis that we're in right now. So if anyone could talk about that, I'd appreciate it.
I see a smile from Elizabeth. Are you on mute, Elizabeth? Were you trying to?
I'm sorry, I unmuted. I mean, I think Lauren and I have been working on an article together on Medicare for All and the Green New Deal, so that's why I smiled. I think it's pretty obvious that the climate crisis and the healthcare crisis are interlinked in a way that is around Corona is become very profound. I know, for example, around my union has been fighting against, pipelines and for environmental justice for a number of years. And so just what is going on around that particular fight around environmental justice and against climate change has been, it's led us to a situation where we're at today. We've gotten all sorts of, indicators and natural disasters and shots across the bow, so to speak, which show from disease to things that happen like Hurricane Sandy and Katrina and, all the different, what happened in the Philippines with tsunamis, all those sorts of things about global warming have to be connected up to a fight around coronavirus. And I think that are connected to, transformative change. Not to get too specific about it, but I think we have to begin to argue that we need some sort of fundamental shift in how we are dealing with fossil fuels and how we're dealing with what's going on with the warming of the planet and what impact that has on workers, and especially the most disaffected of people. Now this thing is just going, straight on across the world, and will disproportionately impact some of the most critically in need and underserved people in this world. So yeah, I guess I'm putting that out, and people should comment on that as well. And that we need to it's connected to fundamentally changing our healthcare system in the United States too. And that's something we can talk more about as well. So hopefully that gives a little bit of some answer to the question.
Thank you, Elizabeth. So we have a very active stack. So I'm going to do one or two more questions, and then I'm going to take it back to our updates on the Earth Day to May Day actions. And then once we get those updates, I can see if there's consensus for us to let the call go a little long to answer more questions, okay? But I want to make sure that everybody who's lined up can speak as well. So let's do one more question, and then we'll switch over to those updates, and we can check in if we want to go a little long. So the next person I have on stack, oh shoot, I just lost it. John Harity.
Okay, can you hear me?
Yep.
Okay, a comment and a question. I went to the emergency room at Hartford Hospital on Monday. There were no corona cases, but the hospital was chaotic. It is overwhelmed with their regular load, and it will just be sunk when corona really gets going. Versus we were in England earlier this year, went to an emergency room. It was like going to the library. It was so calm because people don't depend on the emergency room for the regular health care. So that's just a comment. My question is even though there's a lot of skilled jobs in healthcare, there's a lot of work like moving patients around, serving food and stuff like that. And I wondered what the possibility was of setting up training for people who are temporarily displaced from their normal jobs to get training in helping out in healthcare, and whether the possibility exists of the unions being temp agencies for those jobs, so that those would, even in non-union hospitals, we could actually put temporary workers on who were union members in order to help relieve the crisis, because there is a huge staffing crisis. So that's the question.
I might turn up to Estella. Might be the best equipped to answer that question, or if anybody else has thoughts.
Yeah, I think this is not an easy question to answer, because when you said placing people in temporary jobs, some of the less skilled jobs in the healthcare system, like for nursing attendants, phlebotomists, and others, still require training. Nursing attendants in the state of New York are certified, and if the need arises, because emergency hospitals are set up, what they call intent hospital, something similar to the situation in Hunan, where temporary hospitals are placed. And I know that in New York, the governor made a call for retired doctors, retired nurses, and other retired health professionals, that if the need arises, that they step forward to fill what might be a massive. So far, in terms of the union creating temporary jobs or becoming temp agencies, at this point what we're confronting is how do we protect the safety of the workers in the hospitals. But I am sure that if the crisis deepens, the whole issue of how to deal with the crisis is going to require all of us to think outside of the box and figure out never thought of alternatives to how do we deal with this. And I know this is not the exact question you were asking to hear, but it's not, the way you pose the question is not one that you can come up with an easy answer to it. But what I can assure you, at least for us in New York and in the other 4 states, will represent home care workers, nursing home workers, hospital workers, is that we are doing everything we can to reassure our members, ensure that they receive the protection in the workplace that they need, into our community.
So I'm gonna pause for a second on the stack and take a minute to switch to our updates on the Earth Day climate strikes and Earth Day to May Day actions. Then once we wrap up that, we can go back to questions. Anybody who's been on a call with me before, I'm pretty militant about not letting them run over, but you know, this is an important topic, so I will let us have an extra 10 or so minutes on this call, but I want to get our updates on, so if anybody needs to drop off on the hour, that we can do that. So with that, I'm going to start off with an update from the Earth Day to May Day action from UE Union. Peter Knowlton, the former general president of UE, is on the line and was going to give us a quick update there.
Okay?
Yep.
Okay. So 2 weeks ago, we had a similar gathering, but there was not 73 participants, and the situation was very, very different about the construct of doing a series of actions between Earth Day and May Day. This year, Earth Day being the 50th anniversary of May Day, sorry, the 50th anniversary of Earth Day, and as well During that time, there was also going to be a very large nuclear non-proliferation march and conference at the UN, which is held every 5 years. And there was going to be a large delegation of people, a few hundred, from Zenroren, which is an independent trade union in Japan that our union has a very strong relationship with. So there's going to be a whole series of actions. 2 weeks ago when we had this call, as we were reporting on what we were planning and some of the things we were thinking about of doing and the number of people that we were working with, and it's a coalition of right now 3 unions with others sort of working with us, ourselves, the UE, Unifor, and National Nurses United, along with some folks with the Inland Boatmen's Union, that's part of the International Longshore Workers Union, and some other national unions that we've been talking with, and then a whole host of environmental organizations, including 350.org, Blue Green Alliance in Canada, the Canadian Council, Sunrise Movement in the United States, and some other environmental organizations. And we really had a sort of beginnings of a schedule of doing a series of actions. Obviously, the environmental movement already had scheduled a whole series of actions for 3 days, from the 22nd into the 24th. That included a whole host of activities that we were all supporting and working to help support. And then we were going to do some other actions during that period of time, culminating in May Day, and using May Day as a way to also talk about labor and the environmental movement, and to push the environmental movement, especially in regards to itself, but also in terms of the issues of immigration, to be able to use that issue on May Day as well. However, we sort of mentioned 2 weeks ago that the issue of the COVID-19, though, and its potential spread was potentially going to seriously affect the plans, and that we had already begun discussions about how we could do online work. So we mentioned that. And then last week held, to be perfectly honest with you, a bunch of our unions, we got together, we had a conference call, and right now we are doing everything we can, both in the States and in Canada, to do what we need to do to make sure that our members are protected and that their questions are answered. And I'm sure this is true of the NNU, AFT, everybody else, 110% of our resources are dedicated right now to trying to make sense of this in a way that makes sense to our members, come up with programs and plans and protectionist members and defensive measures, as UFCW Local 21 has done so well. So people are right now so focused on that that we're not exactly sure what shape those 10 days are going to be, and neither is the environmental movement. We have signed on to a letter that's been signed by 16 different environmental organizations, the SEIU and ourselves, dealing with 4 points around the issue of the coronavirus, COVID-19. And it also deals with the Green New Deal. And right now, that is sort of where the Sunrise Movement and some others are at in terms of trying to figure out how to utilize this time to talk about the environmental issues and the Green New Deal. But this crisis has really sort of taken everybody's attention foursquare, to, especially if you're a membership organization, that's where we have to put our resources right now. So it's all hands on deck for us. How we are working on using this particular moment in time as a way to talk about the Green New Deal. And as the sister talked about before, and sort of Brother Harity alluded to it, we're talking about coming up with some positions and some principles with infrastructure development, and putting massive resources to the infrastructure of our country, which is so, as the virus has so so pointedly shown us. We all know it, but it just pointedly shows to everybody how under prepared we are, stripped away. We've allowed the business class to take us to task over the last 40 years. And this will bring the issues of Medicare for all, bring the issues of the Green New Deal. It'll be raising the issues of additional infrastructure development and sustainable technologies, in this country. We expect our own union in particular. We're a hodgepodge. We're a general workers union. We have a bunch of workers in the healthcare sector. Almost all our members are in the private sector. We expect massive layoffs. We think on the order of millions of workers are going to get laid off by this. So this is really going to be taking up a very huge chunk of the trade union movement's time, and also coming up with a series of demands that we're going to be putting on the companies, the federal government, the state government, not only to make sure that workers are being taken care of and protected, but that also our future is being taken care of and protected. And we are four square behind the idea that the Green New Deal is a significant chunk of that, of how we do that. So that's kind of where we're at right now. And we're going to be having a conference call actually tomorrow, a bunch of us, to try to figure out where we go from here, trying to really develop if there's anything that we can do through social media. Thank you.
Great, thank you. Thank you for that comprehensive report. I'm also going to turn it over now to Teresa Yoon from SEIU Local 1 in Chicago, strategic researcher there, to just briefly touch on the changes in Chicago, and then we'll have Zoe from Sunrise after that, and that's where we're at on our agenda. So thank you all. Teresa?
Hey y'all. Thanks for having me. So in Chicago, we have been planning a series of actions from Earth Day to May Day, connecting environmental justice to labor justice to immigrant justice. And in light of COVID and everything everybody else has said, we are pivoting, and those plans are in development, but we definitely agree that this is the moment that we call for a Green New Deal, and this is how we really change everything given this huge economic collapse we're facing. So, you know, I think a strike is always a tactic and not the end goal in and of itself. And so we're just thinking strategically about how we pivot to really have a powerful showing in light of not being able to gather in person in large groups. So we'll continue to share out how those plans developed this wider coalition and share resources on digital organizing and other actions that we can take.
Thank you, Teresa. That's great. So I'm going to turn it over to Zoe. If anybody has put themselves on the stack, if your question is very urgent, please put yourself back on the stack in the chat box, and put your question in there just so I can moderate appropriately with our minimal time left. So, but with that, I'm going to turn it over to Zoe Sina-Skylar, who's the partnerships manager at Sunrise, and who's been a partner with us on these calls before. So Zoe, I'll turn it over to you.
Great, thanks so much, Lauren. Really happy to be here with you all today. I know it's a really heavy moment, both as we face these health costs and as we also, grapple with the economic impacts and the fact that we're living in a society where fossil fuel CEOs are getting bailed out and workers are getting left behind. So at Sunrise, I know we're really taking this seriously and looking at this as a moment to, as everyone else has said, rethink what systemic change looks like, and to be really coming together to be pushing for real solutions like Medicare for all and a Green New Deal that are going to create the sort of shifts we need so we have a more livable community, more livable planet going forward. So yeah, as Peter mentioned earlier, we are doing organizing around these 5 principles for COVID relief and stimulus, which I'll drop in the chat again. And we see this as an exciting framework to organize around, put pressure on our politicians to ensure that as money is moving, it's moving in a good way and not, again, moving to the 1%. So we're, as Sunrise, going to be putting a lot of energy to be building alongside labor and alongside other movements for justice to get energy behind these principles and other parallel efforts that are moving. So yeah, I would be happy if any of you all have questions about these principles. Would be happy to talk more about them. It's still actually not public. It'll go public on Friday, and then we'll be doing some organizing around that. So that's part of what's moving in Sunrise. We're also part of the Youth Strike Coalition, which was, of course, planning to do massive in-person strikes from the 22nd through the 24th of April. And as the situation has developed, has become very clear that this does not make sense. So we've made the decision to move entirely to digital strikes. And from where Sunrise is standing, like, want to be taking action on Earth Day, and also recognize that things are changing and evolving really quickly. So Earth Day may or may not be the right one putting a lot of attention toward. So within the coalition, which is this 9 set of youth groups, there are 2 projects that are moving that are worth sharing about. So one is there's going to be a social community series, so working to counter the isolation that many young people and people of all ages feel by having online calls for people to learn skills and connect across the internet. And yeah, as to this question of what a digital strike is looking like, that can be posting on social media, doing storytelling, otherwise kind of putting pressure, but it is obviously quite far away from a strike as we typically conceive it. And I think the questions of like how to actually make it a meaningful strike is still in the works. There's also a thought of doing a 72-hour live stream that will be bringing together different movement leaders and different artists to speak to the history of Earth Day and the need for transformative climate action. But again, would say that these plans around shifting from in-person to digital are very much in flux, and that the nature of what a meaningful digital strike looks like is still under development. Yeah, so Twitter storms and things like that. So like how can we fill the digital channels in a way that makes it impossible to ignore our messages is the vision and the goal there. So I know we're a little over time, so I'll leave it at that. But yeah, again, really grateful to be on with you all.
Thank you, Zoe, for that report and the great work that you're all doing, and the great work that you will continue to do to educate our universe on what all these digital tools are, like Twitter storms and whatnot. So with that, I'm actually going to turn the call over to Michael Leon Guerrero, the Executive Director of the Labor Network for Sustainability. He put himself on stack. So Michael, I'm turning it over to you.
Great. Thanks, Lauren. Actually, I wanted to do a real quick acknowledgement. Those of you who've been on video probably noticed that Ms. Jane Fonda joined us for the video conference, and she might have actually jumped off, but but wanted to recognize her. And as many of you know, she's been doing this effort called Fire Drill Fridays starting last fall, and it's continued every week. Then it moved from Washington, D.C. now to the West Coast in California. And I just wanted to acknowledge her also. She invited LNS to be part of one of the teach-ins for that effort, and also how she's been centering workers' rights in climate solutions from the beginning of that effort. So just wanted to thank her and recognize and appreciate her for being part of this conversation today.
Thank you, Michael. So with that, I'm going to actually wrap up the call because we are about 10 minutes over, and I promised only 10 minutes over. Obviously, we have a lot of conversation still to have here, right? An hour Zoom call with 70 plus of us is a hard place to have this conversation. So we definitely envision this call as a point to just kind of start this conversation, and it's not the end of it. We're going to continue to work on ideas of how we create space for this conversation. Luckily, LNS has been a pioneer in the virtual field over the last few months, so we're a little bit ahead of the game on figuring out how to use these tools. But so look out for that. But also, this will work best when all of us put into it. So right now, if you have thoughts, ideas, questions, feel free, email me. You all have my email. And if you want to connect with somebody else on the call, if you want to propose something, we'll figure out more ways that we create opportunities to connect. But in the meanwhile, feel free to flood my inbox with thoughts, comments, questions, and whatnot as we figure out how to help each other in these moments. Expect to see from us really lifting up some of these calls to action around supporting workers on the front lines of this crisis. I know there are folks on this call who are from unions, are workers in other industries that are really also hit by this. But I want to make sure we create space for that in the future. My email is lburke@labor4sustainability.org. I'll send you all an email tomorrow as long as you registered for the call. so that you all have some of the notes from today and whatnot. I will also put it in the notes doc if and put it in the chat here really quickly. So with that, I want to thank you all, and be safe, stay indoors as much as possible, take care of your loved ones, and be good to each other.
Thank you, Lauren.
Thank you, Lauren.
Thank you, Lauren.
Thank you so much.
Thank you, Lauren.
Bye.
Thank you.
Healthy,
Everyone,
everybody.
thank you all.
Care, everyone.
Thank you all
Thank you,
so much.
everyone.
Thank you, Lauren.